guys, Dr. Andy here. Today I want to really quickly give you a quick rundown of what the examination or the assessment process looks like whenever we have back pain patients, right? So I am a chiropractor, which does mean that we see a lot of back pain patients, from the upper back all the way down to the low back. It's probably the bread and butter, what most people associate with a chiropractor. So we do see a lot of back pain patients. Okay, so let's just give you a quick rundown in case you're thinking about visiting a chiropractor or me, and you'd be able to kind of at least get an idea of what the process looks like, so you're not surprised and you kind of know what to judge it by. All right. First and foremost, we do have to do a proper history, right? So a history is when we come in, we get introduced to each other, we talk for a little while. That's your opportunity to tell me all about your back pain, how it started, when it started, was there an initial kind of trauma, and how long it's been bothering you and how many kind of episodes that you have had along your way from when it started until when you arrive in my office. So that's the most important part right there. Let's give it a ginormous star because that is probably the most important step through this entire process. And sometimes it can take the longest as well, just because there's a lot to unpack in there, right? So the history, which is when you and I get to chat, easily the most important part, and it's the very first thing that we do when you come in for your initial exam or your initial treatment, and we're trying to unpack what's going on with that back pain, okay? After that, we're going to dive right into range of motion. That's a fancy way of saying I want to see how well the body is moving, right? So I'm going to ask you to stand on up. I want you to bend forward and try and touch your toes. I want you to lean backwards, twist side to side, lean side to side. I want to see what we call that active range of motion, meaning you, the patient, are moving through those planes of motion. I want to see how well you can do it. Most of the time we're going to observe that you cannot move as well as you should be able to, right? And the best part about this is it does give me the initial indication of what type of rehab we should do for you, okay? Most of our back pain patients, they will show what we call like a directional preference, which means that they really are able to move pretty well, maybe leaning forward, but that means that leaning backwards really hurts. Or vice versa, leaning backwards feels fine, but then as soon as they start coming forward, or maybe on the way back up, they're like, oh my goodness, that's killing me, okay? That's what we call like a directional preference, and we actually base a lot of our rehab initially off of that, okay? After that, we dive right into orthopedic and neurological testing. So this is the meat of the exam where we are looking for red flags. Oh, perfect. I'm using a red marker. Perfect. Awesome. So this is where we're looking for anything that comes up that maybe we need to make a referral or maybe we need advanced imaging. We're making sure that you're going to be a really successful chiropractic patient. If something pops up during this part of the exam, maybe we need regular imaging like x-rays, maybe we need advanced imaging like an MRI, or we may need to send you to one of our friends over at Cardinal clinic, like an orthopedic clinic, or maybe see a neurologist, or worst case scenario, we need to send you right to the ER. All right. So there are a couple occasions where if you're coming in and you've got low back pain with a couple of different type of symptoms that come with it, sometimes that is an emergency, and you would go directly to the ER instead of seeing any kind of treatment or making an appointment, in the future with a different type of doctor. Okay. Once we kind of make sure that we don't have any kind of big red flags, we know, all right, this looks like this is a chiropractic candidate. This patient should do really well in our office. Then we're going to start to dive into palpation. Palpation is a fancy word for me saying I'm going to start to poke around. So I am going to have you go face down on one of our chiropractic tables. I'm going to be poking around in the muscle, in the muscles that are surrounding your problem area. So let's say it's your low back, right, and your mid back. I'm going to start to poke around into the muscles of your low back, up into your upper back, into your glutes, and usually very commonly into your legs as well, just because the whole thing is related. So I'm looking at muscle tension, muscle pain, and then I'm going to push a little deeper, and we're going to start to move around and play with the joints and see how well the joints are feeling, right? What I tell patients is happy, healthy joints and muscle tissue feels squishy, right? It should feel like your bed. When we push into happy, healthy tissue and joints, there should be a lot of give, right? Instead, what we're probably going to find is certain areas, it's going to feel like we're pushing into a brick wall, right? It's like we push right into it and the whole thing is completely hard, both the muscle tissue and the joints underneath, there is absolutely no motion. A lot of times that's also where you're experiencing your pain. So when we poke into that, you're going to go, ow, right? That tells us that this is an area where we have loss of mobility. The joint and the muscle is not functioning properly. It's what's driving your discomfort, okay? That's very useful for the tail end of after the assessment for starting treatment, okay? So that tells us some really good stuff. And then right down here is the last thing, is something we've added in more recently, and that's a breathing assessment, okay? I want to look at how well you're able to use your diaphragm and engage your diaphragm to properly breathe. The reason for that is very, very simple. If you hurt yourself, right, if we have a low back injury, we have pain in our low back or even our mid back, we start to usually lose the ability to use our diaphragm correctly. And if you can't use your diaphragm to breathe, right, we actually are not able to create what we call intra-abdominal pressure, which stabilizes our low back. So when we start our rehab program, I want to make sure that we are working from a clean foundation. I want to make sure that we have all of the basics, all of the essentials absolutely perfect, and that starts with your ability to create stability using breathing. Okay, so we're going to see if your breathing is good or bad, and that tells us where we need to start with our rehab. Okay? So pretty simple. It's going to start with the most important part, which is you telling me everything that's going wrong. We're going to make sure that we rule out our major red flag problems, look into how well the body is moving on a global scale. Can you touch your toes? Can you lean backwards? And then get in there and start poking around in terms of the actual muscle and joint tissue, see how well that is moving. And with breathing, that gives us a really good idea of what is causing your pain, and then we'll be able to get started with treating. All right. So if you have any questions, send them my way. Always remember to live with passion, not pain.